Cancer is a disease characterized by an uncontrolled proliferation of abnormal cells in the body. Normally, the cells of the body follow a precise cycle of growth, division, and death, which is apoptosis. However, in the case of cancer, this process is disrupted, leading to excessive multiplication of cells and the formation of tumors. Cancers can be classified into two broad categories. Benign tumors. These remain localized, do not spread to other parts of the body, and are generally less dangerous. Malignant tumors. These invade surrounding tissues and can spread to other organs via the bloodstream or lymphatic system, a process called metastasis. Cancer has been known since ancient times. The first to give a detailed description of it was Hippocrates, around 460–370 BC, who used the terms carcinos and carcinoma to describe certain tumors. The link between certain cancers and environmental or biological factors has been gradually discovered over the centuries, notably with the work of Percival Pott in the 18th century on chimney sweeps cancer. Cancer remains one of the leading causes of death worldwide, with nearly 10 million deaths in 2020, or almost 1 in 6 deaths. In low- and middle-income countries, approximately 30% of cancer cases are attributable to infections such as hepatitis or human papillomavirus, HPV, infection. Projections indicate a significant increase in cancer cases in the coming decades. For example, a recent study predicts that cancer cases in men could increase from 10.3 million in 2022 to 19 million in 2050, an increase of 84%. Associated deaths are also expected to increase by 93% over the same period. Strengthening prevention, early detection, and treatment efforts is essential to address this growing trend. There are more than 100 types of cancer. The most common are breast, lung, colon, and rectal, prostate, pancreas, blood, lymphatic system, liver, stomach, skin. The development of cancer is influenced by many factors that can be of genetic, environmental, or behavioral origin. These factors increase the risk of mutations in cells, which can lead to their uncontrolled proliferation. We have genetic and hereditary factors. Some people have a genetic predisposition to cancer due to hereditary mutations transmitted by their parents. For example, BRCA1 and BRCA2 mutations significantly increase the risk of breast and ovarian cancer. Also, Lynch syndrome predisposes to colorectal cancer, as well as neurofibromatosis and retinoblastoma, genetic diseases that promote certain rare cancers. Although these mutations are present from birth, they do not systematically lead to cancer. However, they increase susceptibility when combined with other risk factors. In addition, environmental and occupational factors also play a crucial role in the onset of cancers. Certain external agents can damage the DNA of cells and promote their malignant transformation. Tobacco contains thousands of harmful substances that promote lung, throat, and pancreatic cancers. Alcohol is a risk factor for liver, breast, and esophageal cancers. Asbestos, pesticides, and certain chemical substances increase the risk of lung and skin cancer. The presence of fine particles and toxic gases such as nitrogen dioxide and hydrocarbons is associated with an increase in lung cancers. The sun's ultraviolet, UV rays promote skin cancers, including melanoma. Ionizing radiation such as radioactivity and X-rays can induce cancerous mutations. Lifestyle strongly influences the risk of developing cancer. Excessive consumption of red and processed meats is linked to colorectal cancer. A diet low in fruits, vegetables, and fiber deprives the body of protective nutrients. Ultra-processed foods, rich in additives and sugars, are suspected of promoting the development of cancers. Excess weight is a risk factor for several cancers such as breast, liver, endometrial, and pancreatic. Lack of physical activity reduces the body's ability to eliminate toxins and regulate cell growth. Some chronic infections are responsible for cancers by causing prolonged inflammation or by inducing mutations in DNA. The human papillomavirus is implicated in cervical, anal, and throat cancer. Hepatitis B and C viruses promote liver cancer. Helicobacter pylori bacteria increase the risk of stomach cancer. Hormones play a key role in some cancers, particularly breast, prostate, and uterine cancers. Hormone replacement therapy used for menopause may slightly increase the risk of breast cancer. Although their link to some cancers is debated, oral contraceptives with long-term use may slightly increase the risk of breast and cervical cancer. Cancer is a disease that can affect different organs of the body, causing a variety of symptoms. These symptoms depend on the type of cancer, its location, and its stage of development. However, it is important to note that the presence of symptoms does not necessarily mean cancer, as many benign diseases can cause similar manifestations. Some general symptoms can appear regardless of the type of cancer. These are often symptoms related to the general impact of the disease on the body. Persistent, unexplained fatigue. Severe fatigue that does not improve with rest may be a sign of cancer, especially if it lasts for several weeks. It may be caused by anemia, lack of red blood cells, in blood cancers, or by excessive energy consumption by the tumor. Rapid weight loss for no apparent reason, more than 5 kilos in a few months, may be a sign of cancer, particularly of the pancreas, stomach, lung, or liver. It is often due to a change in metabolism caused by the tumor. Persistent fever without an obvious infection may be a symptom of blood cancers. Cancer often weakens the immune system, making the body more vulnerable to infections. Persistent pain that does not go away despite conventional treatments may be a sign of advanced cancer. Some symptoms are more suggestive when they are associated with specific cancers. For lung cancer, the symptoms can be persistent cough, more than 3 weeks, unusual shortness of breath, chest pain, presence of blood in the sputum. For breast cancer, we have the appearance of a lump in the breast or under the armpit, the change in the shape or size of the breast, the abnormal discharge from the nipple, the redness or retraction of the skin of the breast. For colorectal cancer, there are transit disorders, unusual diarrhea or constipation, the presence of blood in the stool, frequent abdominal pain, the feeling of not having completely evacuated after going to the toilet. For prostate cancer, we have the frequent need to urinate, especially at night, the weak or interrupted urine stream, the presence of blood in the urine or semen, persistent pelvic or lower back pain. For cervical cancer, we have abnormal vaginal bleeding outside of periods or after menopause, pelvic pain, abnormal vaginal discharge, sometimes smelly. For liver cancer, there is yellowing of the skin and eyes, jaundice, swelling of the abdomen, loss of appetite. For brain cancer, we have persistent and intense headaches, vision problems, difficulty speaking or moving a limb, epileptic seizures. Beyond all, let's remember this. The presence of one or more of these symptoms does not necessarily mean that a person has cancer. Most of these signs can be due to benign or transient diseases. However, it is essential to consult a doctor when a symptom persists for more than 3 to 4 weeks. Several symptoms appear at the same time. There is a progressive worsening without obvious explanation. Symptoms of cancer vary depending on the organ affected and how the disease has progressed. Although the presence of certain signs can be worrying, they do not always mean cancer. Early diagnosis greatly improves the chances of recovery, which is why it is important to consult a doctor in the event of persistent and unusual symptoms.